Close to 1,100 people are in hospitals all across Clark County tonight, each battling COVID-19. Keep in mind that's about 5 times more patients than we had around Memorial Day. We sat down with nurses who described the new challenges on the front lines of this latest surge.
I work in Mountain View Hospital. I work in the medical ICUs.
Neonatal intensive care nurse at San Martin. So I do represent every nurse in the hospital.
I've been getting a lot more COVID patients. They're younger patients. They're getting sicker.
We're starting to see that over the last 2 to 3 weeks. Exhausted is probably not even a word that can begin to describe what they are going through.
Nurses see firsthand the growing surge of COVID-19 cases across the valley. The vast majority of COVID patients in the hospital are not vaccinated. Half are middle age or younger.
They're also dying. It's not just because you're young does not make you safe. A lot of time people are very scared.
We care for the sick and the dying from the bottom of our hearts, and it doesn't matter to us why they are in the hospital.
The Nevada Hospital Association says the latest wave of COVID patients is a challenge for the limited hospital staff across southern Nevada. The latest data: upwards of 7 hospitals report surging above licensed bed counts, 5 hospitals with staffing shortages.
Nurses haven't even really had a break. Those prones where they sleep on their belly in the ICU while they're intubated. We don't have the staff to keep 1-to-1. So they're usually paired up with another patient, which is less than ideal. We're trying to get us travel nurses, but there's just not many nurses out there.
We have nurses that are working 5-6 days in a row of 12-hour shifts because we want to care for these patients. We kind of put our patients over our own needs.
Both nurses say the pandemic led many in their line of work to feel burned out, and exhausted nurses quit or retired. Both their workplaces and hospitals say there are enormous challenges finding nurses. St. Rose Dominican, we appreciate the hard work of our dedicated staff, especially our nurses who put in long hours. We are making efforts to bring in traveling nurses, but they are in high demand as all hospitals find themselves in similar circumstances. Mountain View, we are beyond proud of how our frontline teams have risen to the challenge of caring for our community. The national nurse staffing shortage is at critical levels for certain parts of the country, and our nurses are feeling the effects. We're doing everything in our power to recruit new nurses.
If you haven't gotten vaccinated, wear your mask.
To be kind. We've seen an increase in the number of workplace violence. Be patient. You're just as frustrated as the patients are.
Mountain View Hospital also says they're not at winter levels, but they've started canceling elective procedures with overnight stays. The governor's office explained today that hospitals are trying to give COVID patients monoclonal antibody treatments in the emergency room, so then they don't have to stay in the hospital and it frees up beds.